Good afternoon, everybody. Today is January 14th, 2021, and this is Falmouth Health Department's weekly COVID-19 update. Our phone number is 508-495-7485. Our email is health@falmouthma.gov. And the website is www.falmouthmass.us. So it hasn't been a good week, folks. We are at 853 cases since the beginning of the outbreak on March 19th. With an additional 80 probable since the first of the year. There's been 92 confirmed cases over the past week of January 7th to January 14th. About 80% of total cases are no longer in isolation. That number, as the more cases are closer to the today, like as we get more cases, the cases that are no longer in isolation would go down, the percentage would go down, as more cases are more recent. So Falmouth's about 12.5. We've been staying in that 12 to 13% of Barnstable County. So what that tells you is we're 14% of the population. So we've been sort of hovering. The county is sort of matching, I guess, sort of what our caseload is from in that term. And so it just hasn't been great on the Cape or anywhere else in Massachusetts, for that matter. So here's our weekly case trend. As you can see, we were high since about or after Thanksgiving. With those four dots, the first four dots on the up around the late November, early December being about 40% long-term care, so that was a lot artificially inflated in terms of, if you're looking at it just in terms of community spread. And then we had a couple of weeks where it looked like it might be going back. We had a bad week over after Christmas with 83, and then we dropped into the sort of 45 to 50 range, but this past week we're at 92. So. And then when you add the probables in, we had a lot of probables this week. It was our worst week for the number of cases, no doubt about it. And it's coming in and off the holidays. We had Thanksgiving, extra cases. Christmas and New Year, those extra cases multiply by the same factor, and boom. So, it was 20 might become 60. What 60 might be working its way to 120 per week. Hopefully not, but that's sort of been the trend. So again, everybody used that word flatten the curve early on. It's time we need to be doing that, not just in Falmouth, but everywhere, and starting to get back into our practices of old that we were doing back in the spring. As you can see, the curve, we flattened that curve from about May till sometime in November, but then we've just had this, growth like the rest of the state, and so the counts are up, so no doubt about it. As far as our cases, this has got to do with positivity. We're well above 43 cases, so if we stay below 5% at this point, would be yellow. In terms of positivity rate, which is just the total number of tests divided into the number of cases divided into the total number of tests times 100. And red would be if we had that cases over 43 and a greater than 5% positivity. So we remain yellow. I think we're one of the only towns to remain yellow locally. I mean, a lot of red. I would say pretty close to 2/3 of the state is red. Part of it's because the probables don't show up in here, but also the probable test numbers don't show up in there, so that rate doesn't show up. So it's based off confirmed like it is everywhere else. So you can see that our testing from about Christmas has dropped from around that 4,000 into the 3,000. That's because I think a lot of people are going and getting the probables. Won't show up as a test, as a PCR test. But it's also kind of keeping the counts a little lower too. So that it's about that percentage. And so this is just percentage. And I would assume the rapid antigen test that's occurring at places like Convenient MD and some doctors' offices are meaning that people don't need a PCR. Again, numbers are getting a little lower in terms of our total number of tests, and our case numbers are holding where we're yellow, but the antigen has a little bit to do with keeping it lower, though other towns and other places, we're not the only place using it. So I guess the best way to say is we're all sort of equal with our antigen tests and so forth. So I guess the best way to say is we're still doing better than most, but still high for ourselves is the best way I would look at it. If you look at Barnstable County on whole, for this particular past week, 47 per 100,000. We were about 30 per 100,000 as an incident rate. Their positivity rate was 6.64% for the county, and we were 4.4%. Statewide for the particular week was 8% positivity and 78 per 100,000. So the county generally does better than the state, and we do slightly better on most weeks than the county, but some weeks they're right at it or slightly higher, but lately we've been slightly better than the county. And this particular data comes out as the 2 previous full weeks to the Thursday. So it comes out this past Thursday, it would be the 2 previous weeks. So for example, this week is 12/27 to 1/9. The report comes out on 1/14. So that's where we are. So next week, with the counts that we've had this week, if we have another bad week, well, the next week's data will be the previous week of like 40-something cases plus this week of 90-something cases. And so we may be very well pushing red next week. It all depends on how many tests we're taking. So we're sort of on that teetering on that yellow and red, and we just need to know that for us, it's been not the greatest week or so, and just want to let everybody know. Barnstable County, again, Barnstable County cases just show the same trend that we have, which, makes total sense. The daily dashboard's changed around. It's a little harder for me to make the slides, so I've kind of got it all into one because that's how the state displays it. State over the last week's been a little lower in cases. Instead of, about 5,000 cases with 100,000 tests, roughly around high 5% for that particular day. Slightly down, at 6.67 was the daily average. The other one would be the 6.99 was based on the same 12/27 to 1/9. This is based on the past most recent 7 days. So you can see slight improvement with percent positivity, slightly less cases. Hopefully, the peak was, for the state, sometimes we're a little bit delayed, but the peak in Falmouth perhaps, but the peak is, maybe flattening out a little bit, hopefully, or it's just, an anomaly over this past 7 days and it gets higher again, who knows. Hospitalizations are 2,226, ICU 454 with 294 intubated. The average age of hospitalization is 73, and about 74 deaths in this particular day. All the trends are on the high side, but slightly, are obviously on the high side since, the summer and fall, but slightly better. You can see a little bit of improvement over the last 7 days in deaths, hospitalizations, testing positivity, and cases as well. Just a little bit. Hopefully that's sort of like the beginning of the flattening of the curve, so to speak, for this particular, because we're transitioning into the vaccine, so you want to flatten it out and lower it as we transition into it. Maybe we're kind of getting into that, hopefully. And hopefully us, with our 92 cases, that was our peak, and we started to bring it down into the 50s and keep it at the 50s, and maybe this week particularly was an anomaly, and we go back next week to the 50s, and then that shows us sort of like flattening out as well. And again, only time will tell, and it's all got to do with what everybody does in the town on a daily basis. Hospitalizations here in Falmouth and Cape Cod. For the 13th, this is the most recent one I have. Falmouth Hospital had 12 in the hospital with 4 in the ICU. Cape Cod had 30 with 14. So 42 and 18 with a 53.7 three-day average of hospitalizations is higher than what it was even in April. So hospitalizations are up. It's been up since about Christmas time. Again, more cases, more chances for that to happen. Certain percentage of the population will end up in the hospital and in the ICU, and so again, more cases, more problems, more hospitalizations. Testing hasn't changed. Okay, you can still go through Falmouth Hospital, the Cape Cod the Healthcare Dedicated Call Center at 508-862-5595. There's the community testing line that uses the Barnstable County Fairgrounds drive-through. It's the 508-534-7103 if you don't have a primary. Primaries can also book as well through that. Also, again, Convenient MD has done a lot of testing here in Falmouth. I think they're offering both now PCR and the antigen tests. CVS, the East Falmouth CVS, the Community Health Center of Cape Cod is also doing it. We've always been robust here in Falmouth in our testing. We're better off than most municipalities with the amount of testing that we have. And if you do have any symptoms, you've been a contact, you get tested. Now, one thing that I haven't mentioned in these is I get this call a lot is, when do you get tested? Well, if you're if you have symptoms and you think you've got COVID, you get tested, even mild symptoms. But if you're a contact and you had somebody calls you up and says, hey, I got COVID and you were with me last night, really you should self-isolate and get tested 5 days after that exposure. It doesn't show up the next day. It doesn't show up right away necessarily. Sometimes it does, but it doesn't necessarily. So you would self-isolate for 5 days, get a test. You could be out as early as day 8 from quarantine based on that exposure. So if somebody tests positive and calls you that they got the test results and they were out with you, they should have told you they were getting tested. But again, your exposure, the day of your exposure, your last exposure to a case, when you're under quarantine, you'd wait 5 days, self-isolate during that, then get a test. Okay, so that's a very common question that we get. Again, testing you can get, and that's where we are with that. So there's not much change on that. Nothing changes with the guidance. Everything's just been extended. Indoor events, 10 max. Outdoor events, 25 max. Most things are 25% of capacity. And so nothing has changed on this. If you're a business and you have questions, we're here to answer them. That's what we do. If you have a problem with a business, that's a very common call we get. We do follow up with it. Maybe whether we get back to you or not, we put it in on the calendar, and as we're doing our regular stuff like Title V and things like that and septic and stuff, we will also follow up, usually within a day or two of each complaint as well. So again, a lot of cases, again, the word flattening the curve comes back. We need to do that again. So it's starting to think of implementing the things that you did to keep yourself safe in the spring and do it again. So limiting. So you might have loosened up over the over the summer and in the fall. You need to start thinking about what you did in the spring. It's starting to tighten back up. Your circle of friends, what you do with your circle of friends. Meaning outdoors versus indoors. Limiting the amount of places you have to go. Putting off things that you might have to put off. So again, do the things that you did to keep yourself early, and that you did early in the pandemic, and hopefully you can do that long enough to get you into the vaccine situation, and then you're in a much better position. Again, indoor and outdoor mask wearing in public spaces, hand washing, hand sanitizing, eliminating travel, reducing travel. It's hard during the holidays to do that, and also now we got a long weekend coming up with MLK, and then you have that, and you have different things going on and travel and trips and stuff. Again, that's riskier than staying home, although no one wants to stay home and everybody's definitely got COVID fatigue. Small parties, small gatherings. A lot of times these cases come from the group of circle of friends that you have. People are still working, people are still doing stuff, and then somebody picks it up, and then that circle gets cases. So even within your small circles, and even if you've done a pretty good job, and you might have expanded your circle that you're with. Again, it just takes one event to happen that could work its way to others. So it's the gatherings, it's the parties, and it's the different types of scenarios that you want to try to avoid if you can. Obviously, when you're ill or any symptoms, especially if you're younger, some of these more milder symptoms, you may not think of it, but they could be COVID, so being very well aware. We do have places you can get tested. We do have rapid testing readily available. It's fairly accurate, not quite as accurate as a PCR. We've said that in previous ones, but it is accurate. Again, follow the state guidelines. Businesses need to follow the state guidelines. And so that's what I have to say. Again, you got to keep the fight up. I know it's hard. It's hard. No doubt it's hard, but that's where we're at. Okay, the COVID-19 vaccine. Now, this just changed again yesterday, the day before. Where we are now is in phase 1, about halfway, a little bit better halfway through. The first responders here in Falmouth have had an opportunity to get their first vaccine. Most of your hospital Cape Cod healthcare affiliates have. Other private affiliates are working, their way through it. Congregate care has been set up and scheduled in most places through the pharmacies. And then we work our way to the healthcare workers doing non-COVID facing care is with us soon, shortly. And then we move a little bit different. Individuals with 2 comorbidities, all right, individuals over 75, and residents and staff of public and private low-income and affordable senior housing will be available the next one. And no one can get vaccines for phase 2 yet. So I get a lot of calls about phase 2. Phase 2, we're not able to get the vaccine. Very shortly, you'll be able to register, and the registration will occur on a state. It's a program called Prep Mod. You'll be able to register on that when the time comes. We'll notify through every means necessary of when you can start registering. Then that'll be when phase 2 is given the go by the state. Okay. In terms of Falmouth, we are working on a regional site here in Falmouth. We've partnered with Barnstable County Obviously, towns don't have giant, staff with an exhaustible supply of nurses to supply a clinic. One of the things the state's asked for is the clinics to be able to run all the way through June. So they're not looking at us to do pop-up clinics like you'd see with the flu clinic, come on Wednesdays from, 2 to 5 to get your shot. It won't work like that because of the size and scope of the clinic needs to run, and state wants us to be able to commit to running long-term. And so that's why we've partnered with Barnstable County. We'll have some more details come out as we all get finalized, looking at doing a drive-through. Also, other entities are getting into this. You'll see other opportunities, not just all through the health department. There'll be opportunities for doctors' offices to go through the system, with the hospital, for example, being the depot. Again, still being worked out. There'll also be entities such as your pharmacies and different entities like that will be jumping as well. So you'll have opportunities to get it when the time comes. It won't just be all through the health department. Your local health departments in each town. Again, we're going to go through with the county and do it through their nurses and do it with volunteers and work our way through it that way as well. There'll be mass vaccination sites. The closest one now for a state-run mass vaccination site is Gillette, which is a bit of a ride. I'm not sure if the state plans on doing anything closer to here. Perhaps, maybe not. We don't have that information. We don't have all the information yet from the state. So we're working our way through it. So when the time comes, that's, where we'll be. There's a lot to work through and lots of details, and so that's what we're working through now. And as you work through the list, as you get through one bullet point on this list, you go to the next one, and you go to the next one, go to the next one. And as the vaccine gets released in more and more quantities, and more entities get together and do it, there'll be more and more opportunities. It'll probably, to be honest with you, be a little tricky at the first bullet point, as we're sort of like everybody's getting their feet wet, and then it gets smoother and smoother and more people jump into it. The vaccine is very difficult to handle once thawed, so you have to be careful. You just can't put it in the back of your car and drive to spot to give out the vaccine. Once it's thawed, it is difficult to handle, at least these Moderna and especially the Pfizer one. So, they have to be in a very controlled sort of way of doing it. So that's where we are with vaccines, and that's going to be sometime starting maybe right around February and lasting till April. That's phase 2. And then phase 3 would be as things loosen up and more places get it, and everybody gets their groove, and all these sites get their groove going and start cranking out the vaccine in phase 2. Phase 3, jump to phase 3, and then that'll be through April through June. That's the reason why the state's asking for us to have a standing site through June. So it's not as simple as like we do our flu clinics, where you just set up the Gus Canty with a couple of tents and cones and go from there. It needs to be open through June. So it's a little bit different. A lot of bit different, actually. So when would you be able to get your vaccines? Again, we've taken care of the first responders. We're in order of where we're supposed to be. We cannot order vaccines for any other group at this point. Again, the state's not released all the details. We're in preparation, okay? One thing, we're not going to let people jump on the line. We do get a lot of calls and emails and people telling us that they really should be getting it now and so forth. We're not going to be scheduling. That's going to be done through a statewide program. Otherwise, an Excel spreadsheet in one town and another, how is this information getting to the state? So it's going to be registered through the state on that website when the time comes. Anybody who's medical, even non-medical personnel that want to volunteer, there's Diana Gamond at the MRC. MRC stands for Medical Reserve Corps. You can call her at 508-375-6641 or email her at diana.gamond@barnstablecounty.org. We have over 200 people so far, I think new people. So we're going to need them all because each clinic's running, right? So Falmouth, the site here in Falmouth, Upper Cape Regional, Mid Cape, a couple down Capes, plus maybe even supplementing with others as needed. There's going to be a lot of need because if you're running these for 5 days or so a week or more, that's a lot of task of volunteers. So there's a bank of nurses, and that's where the county really helps each of the towns, where is a clearinghouse for not only the vaccine storage and ordering and managing of the prep mod, also the staff that's going to be doing it. So it's quite a big undertaking, and we're not ignoring it. We're not, I've had some people that have been, angry with us. We are working our way through it. We'll get there when the time comes. So as a little bit of a recap, state remains high. It seems a little bit flat, but hopefully it starts to go down a little bit. This is our highest week we've had. I didn't really change the slide. So the stable over the last few weeks is out the door. Sorry about that. But yeah, we are the highest we've had. We had our worst week. Community spread is definitely occurring. The vaccine is being administered as the state's requested. Cape Cod Healthcare, long-term care, first responders, congregate livings, all in this phase right now. And further vaccine information will be released as it becomes more clear, as everything gets set up and released all in sort of all in due time. Okay, so it's just not going to be a free-for-all, line up for 3 days in a parking lot waiting for your shot. That's not how we want to do it. So that's what we have for an update. Everybody stay safe, and again, start thinking about the things that you did early in the pandemic to protect yourself, and start reinstituting it into your lives. Thank you.